1 in 6 couples in the UK will experience difficulties conceiving, and one of the commonest causes of difficulties conceiving is lack of ovulation in the woman. The most common cause of anovulation is polycystic ovarian syndrome. The term polycystic ovaries is a misnomer. When first discovered in the 1930s, it was thought that these women had abnormal ovarian cysts, but we now know that they don't have abnormal cysts, but an above average reserve of eggs with lots more follicles. Our follicles are the egg containing structures within the ovaries. These women have larger ovaries than average due to the abundance of eggs, and they tend to go through the menopause much later than average. Polycystic ovaries are therefore larger in size, containing lots more eggs than average, and 25% of women have got polycystic ovaries. So how do we diagnose polycystic ovaries and polycystic ovarian syndromes? With polycystic ovaries, these patients would have raised numbers of antral follicles on ultrasound scan, and blood tests will show a high AMH consistent with an above average reserve of eggs. Polycystic ovarian syndrome, on the other hand, would have polycystic ovaries on ultrasound scan, but in addition to this, will have symptoms or signs such as irregular periods, due to not ovulating regularly, or evidence of raised testosterone levels, either excessive body hair or acne or oily skin. The best investigations to diagnose polycystic ovaries is therefore an ultrasound scan of the ovaries and a hormone test, the AMH. With polycystic ovarian syndrome, a testosterone test may be required as well to confirm the diagnosis. One of the other long-term consequences of polycystic ovarian syndrome is being at an increased risk of developing abnormal uterine womb lining cells, especially with those women who are overweight and not ovulating regularly, and therefore not having a regular withdrawal bleed. It is very important that if not having periods for more than 3 months or 4 months, get your GP or your gynaecologist to dispense some simple hormonal treatments for a 5-day period, which would shed the womb lining to minimize this risk. Up to 20% of women in their 40s with polycystic ovarian syndrome will develop type 2 diabetes, and it's therefore very important that their GP checks their blood sugar every year to pick it up in good time and manage it appropriately. Weight loss would also help with management of type 2 diabetes. How do I get pregnant with polycystic ovarian syndrome? As mentioned previously, the main problem with polycystic ovarian syndrome is not ovulating. Where diagnosed in good time, simple hormonal treatments such as tablets or where required injections would enable women to ovulate regularly, and with regular ovulation, they should be able to conceive naturally. 80% of women with polycystic ovarian syndrome who take hormonal tablets such as Clomid will get to ovulate regularly, and 40% of these would conceive within 6 to 12 months. However, if they do not conceive spontaneously, or if there are other factors such as male factors or tubal blockages, then they would require fertility treatment such as IVF, and their chances of successful conception are the same as for those who do not have polycystic ovarian syndrome. They may over-respond, and one of the reasons we're very cautious with stimulation with polycystic ovarian syndrome is they may produce too many eggs, which may produce ovarian hyperstimulation syndrome. At Herts Essex Fertility Centre, we use a specific regime that minimizes this risk. Therefore, it is very important that investigations are started at an earlier stage and when women are younger, because if treatment is required, then the chances of getting pregnant are going to be much better the younger they are. If treatment is not required, then lifestyle measures such as weight loss, stopping smoking, alcohol intake reduction would hopefully enable them to get pregnant naturally, but if require fertility treatment, this will help as well. At Herts Essex Fertility Centre, we're aware of the long time it takes for couples to get investigated, and we've therefore devised a one-stop fertility assessment service, which within a 2-week period would be able to provide all the answers that you require to determine whether you have a problem getting pregnant or whether you need some fertility treatment. We're here to help, and if you want to discuss more about polycystic ovarian syndrome, please contact us at Herts Essex Fertility Centre to make an appointment with one of our fertility experts to discuss the best way to get you pregnant with this condition.